Hey, good morning, everybody. Dr. Heather Smith at Living Well.
Dr. Marley.
Dr. Chris.
We're here coming at you with your weekly doc talk. Hey, guys, I want to just take a minute and just say thank you. I'm going to introduce the topic of today, but for all of you who follow our regular doc talks, we get so much positive feedback from you guys, and we appreciate it so much. We also get some negative feedback, right? We get people who are disagreeing what we're saying, and you guys, the ones that are appreciating it and you're commenting and you're liking and you're loving, you guys are the ones that keep us moving forward with this and trying to just, you know, tell more of the truth about health to the world and to anyone who will listen. So thank you so much to those of you who keep us wanting to do this for you guys every week and take the blows for the people that don't appreciate it. So how we feel, you guys, as chiropractors, we're always going to be on the side of minority, right? We're always going to be defending the way that we believe that the body works, the way that we have knowledge that the body works, and the way that we think about health. And we're ready, we're ready to take those blows and to take those hits so that we can get the truth out to those of you who want to hear it. So for today, we're actually going to be talking about vitamin D. By no means are we saying that vitamin D is a cure for any virus. It's not a cure for anything, but it is a very essential nutrient that we need, and we're going to talk to you guys about just some research behind some of that. So I'll step back here and let somebody else say it.
So at Living Well, we always say that there's two causes of disease, right? There's toxicity and there's deficiency. And one of the major deficiencies that almost everybody has is vitamin D. And it's plain and simple. We normally get it from the sun, but we're not outside as much as we used to be or as much as our ancestors used to be. So it is something that we recommend almost everybody supplements with. Now, we're lucky this time of the year we can actually get it from the sun. So between about here in Wyoming, May, September, that is like the prime time to get outside, get some sun exposure, and that's how you actually create vitamin D in the body. I got some awesome research articles here involving vitamin D and acute infections like influenza and even COVID. Now, once again, I'm not saying that vitamin D is going to prevent you from getting influenza or prevent you from getting COVID, but they see a direct relationship between vitamin D levels and your risk for those respiratory illnesses. So what I'm saying is when your vitamin D levels are low, you're at greater risk for developing something like influenza or even COVID. So if you want these articles, some of them are pretty lengthy. This one is extremely interesting. It's looking specifically at COVID, and I gotta tell you, it's not peer-reviewed yet, but the information here is actually really, really compelling. And what they found is the individuals that had the most severe reactions to this virus, when they looked at their serum levels of vitamin D, it was extremely low. So it didn't even hit the normal reference range that the medical profession sees appropriate, which is about 30. We always recommend that individuals are above 50 when we look at that serum level of D3.
Right.
So really interesting. The other thing is I got a very long article that talks about influenza as well as vitamin D levels. And what vitamin D does is it's really important for our innate immune response, so our first line of defense against any bacteria, virus, any of that stuff. And we know that when we look at those respiratory illnesses, it's not always that acquired immunity that's going to protect us. It's actually that first line of defense, the innate immunity, that protects us the most against things like COVID and influenza. So we want to make sure that our vitamin D levels are sufficient if we want to naturally be able to resist these infections.
Right.
So and the evidence there is clear. You can go on PubMed and you can look up vitamin D influenza, vitamin D immune response, and there's a plethora of information. So if anybody wants to dive in deeper, I mean, you could read for days on vitamin D.
They've even done research on the difference between vitamin D and the flu shot, which is better at preventing the flu. So I mean, it's all out there for you guys. So once again, we're not relating COVID to influenza. They're not the same thing. We know that, but you know, they're both respiratory illnesses, and vitamin D plays a huge role in that innate immune response.
And what we are saying is we're not saying vitamin D is going to treat these things. It's not a treatment. All we're doing is we're addressing a deficiency so that the host is more resilient,
right?
If that makes sense.
One of the things that we were just talking about is that there's this quote going around Instagram right now, which I really love, that says we need to shift the focus from how long can we hide from this virus, how long can the economy stand it, how long can the people stand it, how long can our children stand hiding inside from the virus, and instead shift to how do we just strengthen our bodies, right, and our immune system's response so that when we don't hide any longer, we're stronger, okay? So this vitamin D is one of those things. What do you have to say, Doc?
I was going to say, aside from acute illness, what else is vitamin D good for?
Vitamin D is really good for calcium absorption within the gut, which is important for good, healthy bones. So it's going to increase that bone mineral density and prevent anything like osteoporosis from taking place. It's also good for overall neuromuscular function, in addition to immune system function, overall cellular growth, as well as cellular function, and reduces inflammation within the body.
Lots of reasons.
Yeah.
So, like we said, it's one of those nutrients that almost everybody is deficient in. It's just because we don't get as much sun exposure as we used to,
Right.
and it is a vital nutrient for so many different functions in the body, all the way from gut health to bone health to muscle health to immune function to actually mental health and your neurology, your neurologic health.
I have a patient right now, you guys, that was struggling with just like chronic widespread pain. She was in so much pain all the time, and the only thing she switched was she started taking our vitamin D supplementation, and she is night and day better. She's just amazed, and she tells everybody, and nobody believes her. So it's like, you try it, it's risk-free. Taking a vitamin is not going to cause you any harm, but it could in fact massively improve your overall quality of life. So one more quick thing about vitamin D in the sun. Sunscreen is a big, obviously everybody is concerned about skin exposure, and skin cancer rates are on the rise, and we're all sunscreen crazy. That's okay, do what you want with that, but let me just tell you that your kids and you need at least 15 minutes in the sun with your skin exposed with no sunscreen. If you put it on before your kids even step outside, they're not going to be able to synthesize the vitamin D properly. So let's make sure the first 10, 15 minutes, 20 minutes, let's let those kids and yourself be outside sunscreen free.
Some practical tips. If you guys are going to get any blood work done, recommend that you throw a vitamin D panel on there. It's, super cheap. It would probably be another 20, 30, 40 bucks. So throw it on there, actually see what your serum levels are, and then you can adequately supplement. But for most people, especially during this time, as we're just getting into the seasons where we can create that vitamin D naturally, we want to be supplementing, if you're an adult, probably about 5,000 IUs a day is typically the standard.
Yep.
So,
cool.
And we want to make sure, once again, that those levels are above 50. So if you have any other questions about vitamin D, if you want the research that we have, just let us know. We'll post it below.
Thanks you guys so much.
Have a good weekend.